when you're on a GLP, protein is so important. So I always 100%, I'm like, this is a non-negotiable thing for me, is that you have to be taking and supplementing with something with protein, with aminos, collagen. Collagen is not a perfect protein. It's not a complete protein, but if that's all you got, I'm okay with that too. But definitely the top tier first thing is the accelerated aminos. That has been the favorite one. So definitely have them on that. At least five. Sometimes if they are on a more aggressive like weight loss protocol, then maybe even more, maybe like 5 tablets in the morning, 5 tablets in the evening, just to meet those protein needs. Because the last thing you want is, yeah, you're losing weight. You want to lose, most people want to lose fat. I think, oh, well, I would say all people want to lose fat. And you want to retain muscle. And how you do that is you want to make sure that you're getting enough protein to signal to your body that, oh, there's enough protein. So the protein is going to create protein synthesis. The body's going to utilize the protein, preserve muscle, preserve your joints, connective tissue, tendons, ligaments, your skin, hair, nails. And that's another common thing is hair falling out.
Mhm.
I think that more often than not, that is a very undesirable side effect, right, of that. And I think that has to also go back to the nutrient deficiency, because when you're slowing everything down, right, essentially we're trying to tell the body, hey, there's not going to be that much food, and you're not eating that much, and so your metabolism slows down. And so your body will prioritize the nutrients for necessary actions like cardiac, right? Your heart pumping, your lungs breathing, your digestive system moving, right? Your immune system defending, your brain functioning. So your hair and your nails, not a very critical
Yeah.
task there. So it's not going to prioritize on those things, and it will let your body, well, it won't regulate it, it won't maintain it. And it's kind of like a garden that's just not well maintained. It doesn't look that good. And so that's where we get into like accelerated aging from a cosmetic perspective, as well as people losing their hair and shedding and things like that. So these are some of the things that I would say to look out for, some tips and tricks.
So I have to echo everything that you're saying as far as, okay, great, we're seeing the scale go down, but at the expense of what? And then I'll get the calls, oh my gosh, my hair is so thin, my skin is creepy, I need to go get more Botox. Well, it's because of the collagen and the lack of protein but I've been at a meal with someone on a GLP where they're looking at their beautiful steak or fish or what have you, a healthy meal, and they literally cannot think about putting that protein in their mouth because they're nauseous or they just have no appetite. And that's where the accelerated aminos have been a game changer for those people. If people are on GLPs, I say you have to be supplementing with the essential amino acids and a collagen. And we have the accelerated collagen peptides out. I'm super excited for you to try them, Calvin. But those marry very well together as far as supporting the skin, the hair, the nails, and the muscles, and all of your tissues. Every tissue and organ in the body needs protein. And like you're saying, if you're not taking in enough, your liver and your heart are going to use that protein before it gives it to your hair. So that is, great, you're skinny, but now you're bald and you look old. That's not what most women especially want.